Okay, well, um, thank you all so much for what an incredible day we've had, right? I mean, we really were greedy in what we tried to hear today. Everybody exceeded our expectations, and I thank again all the speakers today. We're going to continue a half day tomorrow, but I just want to, before we finish for the day, I want to just walk us through a few of the key points that our collaborative has learned in our work. I think it underscores some of what's happened already today, and many people raised some of these. I just want to close us off with some of these things to think about for tomorrow. So, we designed this workshop to touch on the very thing that you just mentioned, Lark, which is that, the Affordable Care Act is raising issues like accountability and health promotion and prevention, and we are seeing incredible opportunity within primary care to really make change, and that's part of why we do feature it a little bit here. But we know that there's going to need to be integration across other systems, and we're hearing that, we've heard that a little bit more as the day went on. We know that the Affordable Care Act also affords us the opportunity to pay attention to parents and to parenting, but we still have a long way to go because many kids are insured with Medicaid now and parents are not. Right? I mean, that is just a huge problem. So, we still have a lot of work to do on the public policy side. The school-based health centers were not funded in the ACA. A capital expansion was, so there was new facilities stood up, but a lot of what John described about the National School-Based Health Alliance, the operations of those school-based health centers has not been funded by the ACA. That's another huge gap. We've heard again today, but we learned in our research over the last year that a lot of really good innovations in research and services that have been driven by the ACA are still adult-centric. That's still another problem that we have to take on. And one of the things that I found most helpful, and I forget who said this, but what you may be sitting here, so I apologize, is that it's going to be important for us to engage the adult health community to teach them about the life course health perspective. Like another silo we're not paying attention to is pediatric and adult health systems. And so we need them to be partners with us, not the other side who's getting all the money and all of the programming. There's a lot of exciting opportunities for alignment and collaboration, especially with education and health. I find it so ironic that we used to have a federal agency of health, education, and welfare. Isn't that ridiculous, right? And here we are back again saying, wow, why do we have these silos of health and education and welfare? So, I could go on, but it is important for us now to start to think about, especially for a research agenda, that we start to track in both investments and outcomes across social services and across education and across health. And that was raised in some of our information gathering calls, that social services, for example, may have outcomes on health, but they're not being measured, and vice versa. There's one thing I want to mention as a caution, and we've had this in other workshops, that terminology differences still pose a barrier. So, there's different definitions for integration. There's different definitions for behavioral health, and there's different definitions for evidence. Those are just a few, but those are still really important barriers that we need to take on. There is a lot of movement in measurement and in screening, but we still have a long way to go because a lot of good screening measures, including some that federal agencies are trying to stand up, are not yet well translated for certain populations or validated for certain populations, especially some of the most vulnerable ones. So that's still a problem. And then a last point from this information gathering work is that the policy emphasis in the ACA, and maybe rightly so, as a starting point, has been access to care. But it doesn't mean there's providers to deliver that care. And then there's a further gap for delivering evidence-based practice, right? So access might be improved, but it's only the beginning, and so we still have a huge amount of work to do there. Okay, so it sounds to me, though, from listening today, that we're kind of at something of a tipping point. You know, there was a lot of consistency across several people in terms of what they're recommending. And that's an exciting point. We also heard that it was a gargantuan task. But I think we're up to the job, and we're going to actually try to move the needle a little bit more tomorrow. So I hope most of you will be able to come back. I know a few of you need to leave, and for those of you who won't be back tomorrow, thanks so much for coming, and we'll be back here at 8:45 tomorrow.